and welcome to our special program. I'm Gargi Rawat. Did you know that 89 to 90% of adults in India have dental cavities, and what causes these cavities? Most often it's poor oral hygiene, and as a result, food particles trapped inside our mouths play havoc, causing bad breath, growth of bacteria and plaque, and eventually tooth decay and cavities. And that is why your teeth hurt when you bite into an apple or when you eat an ice cream. Ignoring the pain could have serious consequences for the rest of our body as well. March 20th is World Oral Health Day, and on our show today, we're going to talk about how a healthy mouth is very necessary for our overall wellness. So welcome to Protecting Beautiful Smiles. Talking about oral care with us today is Sagar Avatade, CEO and founder, Oracura, Dr. Neil Bhattavedkar, who is BDS Mumbai and MS USA and MPH USA, and Dr. Anjana Satyajit, Head Dentistry, Artemis Hospital, Gurugram. Dr. Neil, I'd like to start with you, and if you could explain to our viewers what flossing is and how it's different from brushing.
Thank you. I think one of the common misconceptions in India is that brushing is equivalent to flossing. And I would like to point out that that's not the case. When you do brush and you don't floss, you're actually leaving out 40% of the surface area of the teeth. So flossing essentially comprises of cleaning in between the teeth, either with a water flosser or a dental floss or a water jet of some sort. And that is crucial to preventing gum disease and preventing cavities.
All right, Dr. Anjana, what are the most common oral care problems that people come to you with?
Major problems that I get to see in my clinic is tooth decay, which could be anything from mild to moderate to severe. In mild tooth decay, you'll maybe see a small little hole or a black spot on your tooth surface. And this can progress to something which is very severe, where there'll be a lot of tooth loss, there'll be infection, there'll be swelling, a lot of pain. The second most common thing is the gum problem, which can start from a very basic, a spot on the, on an apple of blood when you bite into it, to something like a little bit of bleeding when you brush, to an extreme case where the tooth structure and the tooth supporting structure can become loose and the tooth can fall off. And the third most common thing that I get to see is sensitivity in teeth, which is a electric or a sharp impulse that a patient feels when they bite into something or they take something cold or hot or sugary substance.
All right, so Sagar Avatade, if you could tell us what is a recommended routine of oral care, and how is your technology aiding in higher level of oral hygiene?
Right. So only brushing doesn't suffice a purpose, as Dr. Neil and Dr. Anjana said before. So brushing doesn't suffice 100% oral health. So to have a recommended oral health, you should do the properly twice a brushing as recommended by dentist. Even you should do the flossing on regularly basis. So flossing is not an optional activity. You should do the regular flossing. But the current oral care routine, which is precisely more not very comfortable for the consumers in terms of it's not very easy. It's a tedious and time consuming. So following that is the big challenge for the consumers or for the users. So we as a brand, Oracura, coming into the market with a product, with a technology which is going beyond your ordinary or traditional oral care methods. So as dentists recommend, you should do the 2 minutes brushing, you should do the flossing. So our product portfolio, which compromises of water flossers and electric toothbrush, so these products are precisely more focused towards maintaining your daily routine with easy, effective approach, and quite convenient and faster as well. So we are providing a technology products which gives the consistency to the user. It shouldn't be done once in a day or multiple times. It should be done on regular basis. So this routine, to get the consistency, we are just making sure 2 minutes water flossing, 2 minutes brushing as recommended by dentists.
All right. In fact, I feel Indians aren't that familiar with flossing, and there are different types of flossing as well. So, Dr. Neil, if you could tell us, there's regular dental floss, air floss, and water floss. Tell us which is the most effective way of tackling plaque.
So, as you rightly mentioned, there are different ways of cleaning and flossing in between the teeth. The major differences between the techniques is whether it is mechanical cleansing, whether it is irrigation, or whether it's a combination of the two. Traditionally, dental floss has been used either waxed or unwaxed. And I would say that even in India, even traditional floss has not been used for the longest time. And I think this is something that really needs to change because, like I mentioned to you earlier, when you have plaque accumulation between the teeth, that leads to further inflammatory problems. And the inflammatory problems also have a systemic health relationship, which means it has impact on the rest of the body. It doesn't remain only in the mouth. So in terms of the modalities of cleansing, water flosser is very effective. One of the biggest challenges that people have sometimes with regular dental floss is dexterity. So a lot of our older patients, senior patients, sometimes have a difficult time managing traditional dental floss. But all of these three techniques remain effective. But the key is to do it. The key is to make sure that one doesn't just brush, that one flosses as well.
All right. And Dr. Anjana, what are the major reasons for tooth decay?
Basically, the bacteria in our mouth forms a thin film around and over the teeth almost every day. So which, if it is not diligently removed, would actually take the sugar from the diet that we take and convert it into acid. So that will, over a period of time, will cause cavities or would to cause tooth decay to happen. So if you have poor oral hygiene or you have poor dietary choices, there are more chances of you getting tooth cavities than normally. So like everybody said, twice brushing your teeth is almost not enough. You have to floss, and many areas where you cannot even reach with the dental floss, you have to wear a floss.
All right. And Sagar, if you could tell us about your sonic toothbrush. Is an electric toothbrush also more effective in keeping the mouth clean compared to a manual one?
Absolutely, absolutely. So normally the brushing technique which has been followed in most of the patient is the not right approach. They do the brushing which is having a stroke of front and back stroke, but that is not the right way to do the brushing actually. So most of the dentists recommends doing the brushing like taking your brush and remove the plaque from above areas. The brushing technique itself is incorrect, which has been commonly used among the users. So the Soniac electric toothbrush, which follows the dentist recommendation in terms of making a Soniac vibrations, which removes the plaque easily, and also it has a timer of 2 minutes, which makes sure dentist recommended to brushing a 2-minute brushing time.
All right, and I'd like to get all of you, your tips on oral hygiene. If you could tell us, Dr. Neil, starting with you.
Sure. So I think one basic thing I would suggest is ensuring that the viewers understand that brushing and flossing twice a day is important. Not just in the morning. It's actually more important to brush and floss at night, because the amount of time that plaque remains, carbohydrates remain attached to your teeth and your gums, that is actually when trouble starts. So if you sleep at night and you don't brush or floss at night before you sleep, you're actually causing a lot more damage than by just brushing in the morning. So it's extremely important to floss and brush at night. That's number one. Second is it would be advisable to incorporate some sort of a mouthwash along with your daily oral hygiene. You could even use the mouthwash as an adjunct to all of these techniques. But understand one thing, that the mouthwash again is not a substitute for mechanical cleaning. So a lot of people, I know that they just brush and they sometimes use a mouthwash, but they don't floss. And it is extremely important to not bypass that one step.
All right, so don't just bypass brushing and flossing with just a mouthwash. And Dr. Anjana, what tip would you give to viewers?
I would agree with him completely. Lots of people think that brushing twice is enough, which it isn't. You need to mechanically remove everything that is in between your teeth with either a dental floss or a water floss. And another suggestion that I would like to make is that if you could reduce your in-between snacks and sugary snacks, that will also help a lot. And you have to rinse your mouth with a mouthwash or with even plain water in between your meals.
All right. And Sagar, any tip that you'd like to give the viewers?
Yeah, so normally the way brushing has been recommended twice a day, the flossing activity should not be a activity which should be missed out in routine. So you eat multiple times, so you should have, so you're normally having a meal twice a day or thrice a day. So once you eat, you should floss. So we have a portfolio which you could carry along with you during your office time. So once you eat, you should floss. So once you eat, the plaque gets accumulated, a lot of particles get here and stuck, which is a key areas where cavity starts. So I think I would make an additional recommendation. What doctor has already recommended is like, once you eat, you should floss.
All right, after every meal, then try and floss, and after you eat, try and floss. And also, Dr. Anjana telling us not to eat so much sweets in the middle. So those are all important tips to protecting your beautiful smiles. We'll slip into a short break and return with more. Stay with us. Welcome back. You're watching our special program on oral hygiene and protecting beautiful smiles. And let's go across to our panel. Dr. Neil, you were talking about, the impact poor oral hygiene can have on our overall health. If you can, explain that and tell us why is it so critical to maintain oral hygiene?
Absolutely. I think this is one of the most neglected questions and connections, not just in India, but worldwide. There's been a growing awareness amongst physicians, cardiologists, and other medical professionals about the impact that dental health has on all other systemic issues. There is a very closely researched aspect of periodontal disease, which is gum disease, and how it impacts diabetes. India being almost a diabetic capital of the world, we have to be even more careful about making sure that we take care of oral health. So what we do know is when you have plaque accumulation in between the teeth, you have inflammatory cytokines, which are inflammatory markers that increase. And these in turn have known to be have a negative effect on blood sugar maintenance. So in fact, some research has also shown that if you treat one, the other one gets better, which means if you treat periodontal disease or gum disease, blood sugar spikes or blood sugar fluctuations also tend to decrease with time. So this is one of the many aspects. There are many other associations of gum disease with heart disease, atherosclerosis, strokes, etc. The American Academy of Periodontology has a lot of research which has been published, which is accessible to the public. And this is very, very important to keep in mind. So it all comes back to simple habits that you can change for yourself and your daily regimen. As I mentioned earlier, just making sure that you brush and floss twice a day, decrease your intake of food in between, and making sure that you combine this with other habits such as exercise and a daily schedule will make sure that you keep other health issues in check as well.
All right. Sagar, what about children's teeth? And that's when most often dental issues begin. And can children use an electric toothbrush and water flossers safely?
Yes, absolutely. So let's say if the children's age is 3+, then they should do it under their parents' observation. And for 8+, they could do it independently. So children's oral health is also one of the vital role in terms of oral hygiene. And for a children's, because children are prone to have a lot of foods. They can't eat twice a day or thrice a day the way the adults does. But the children keeps on hopping into the snacks. A lot of food gets stuck into their teeth, which creates a major cavity. So I think taking care of oral hygiene or maintaining the oral health of the children, which is very, very important because that's the start of your oral health. And precisely to cater to that, children are quite negligent in terms of doing the brushing. So normally if you try to see, children are not very keen to do the brushing and follow the habit. So we have an electric toothbrush as well as we have the water flossers currently, which is like a family model of a water flosser. And we are developing a dedicated range for the children altogether, wherein they should have a low water pressure under the water flosser. And even for electric toothbrush for the children, we are going to have a soft bristle, so they are not very hard for the teeth of children. Even we are trying to figure it out to add some music, so the children becomes more engaging towards doing the brushing activity. and they should follow. Once the habit of maintaining oral hygiene starts developing from the smaller age, then it is easier to follow the lifetime. So this is not like an option even for the kids. It should be consistently developed throughout the day. So as I said before, children's oral health is very, very important in terms of so the vital role which has been played by the parents, and even we could see that in their education they have a basic knowledge, like children should do the brushing. So flossing is one of the activity which I could see in the syllabus missing. So it would be great if we could look at having awareness about the flossing from the children. So we are trying to do that, developing a new range and trying to make sure children start developing this habit from their age, which is like 3 months.
Right.
Yeah.
Right, and through this show as well, creating more awareness about these issues and the importance of inculcating this good oral hygiene from a young age. Dr. Anjana, how big is the issue of poor oral hygiene in India? The statistics seem to suggest that despite a wide prevalence of dental issues, only about 50% affected people will visit a dentist. And I have to say, it's a very dreaded visit to the dentist. But if you could tell us about that.
Yeah, people actually neglect and ignore their teeth as long as they possibly can. And if you think about our country, most of the population is in rural India. So 65% is there. So only 35% of people actually get proper dental care. Among that figure also, almost only 28% will actually come to you regularly for a dental checkup or whatever they need. I think it is mostly people are scared of visiting a dentist, and also they feel maybe they have 32 teeth, so if you lose 1 or 2, it doesn't really matter. So that's a very big problem area.
All right, so Dr. Neil, coming to this issue of visiting the dentist, obviously if you take care of your teeth and, observe good practices around oral hygiene, you will need to visit the dentist less often. But really, how often should one visit the dentist?
That's a great question. So being a periodontist, I'm a periodontist, which is a gum specialist. We typically get patients who come in when there is a problem. And what I keep telling them is, it's, think of it like servicing your car. You take your car only when you have a problem. You don't. You take it every 6 months or every couple of months. So similarly, the recommended frequency is a minimum of 6 months, a dental visit, assuming that you don't have a problem. If you have a problem, that frequency actually might be a little bit shorter. It might be 4 months. The same thing goes for dental cleaning. So when a dental cleaning is done, it's typically done at the 6 monthly mark. So as you mentioned rightly, no one really likes us, right? No one likes dentists, no one likes being in the dental chair more than necessary. But I think it's one of those things where things have changed tremendously with technology. Dental visits are a lot more pleasant nowadays. We make sure that the patient is as comfortable as possible in the chair, take care of anxiety and other issues. So I think it has become less of a burden on the patient. It's not as dreaded as it used to be. I think once patients imbibe the 6 monthly visit, you will see a gradual change in the Indian stats in terms of decrease in oral health problems in the years to come.
Right, and one way to prevent cavities, as we've been emphasizing through this show, is by better, oral hygiene. So, Sagar, just how do we make brushing of teeth easier and more effective, and how can we ensure that people do it more often and realize just how important it is?
That's right. So, brushing could be done very easily with the help of, like, if you try to see the Western countries or even European countries. Most of the people are aware. So you get the electric toothbrush in the retail stores. So the accessibility to the products are very easier in other countries. So we as a brand, we are trying to get into having a better accessibility to the good products, dentist recommendations, and to have an effective brushing. So electric toothbrush, so we have one toothbrush which is having almost 48,000 vibrations per minute. So which is very strong, and it has a multiple modes. If you have a sensitive teeth, you have a specific mode. So the brushing techniques get changed with the help of mode. Then we have a polish. If you want to do some sort of a polishing to the teeth, we have a polish mode, and even pulsating mode also. So we have a multiple modes in electric toothbrush, which is very easier for a different, because every user's requirement is different. It's not the same. So some has a sensitive teeth. Someone is looking at the electric toothbrush to remove the plaque. Someone is looking at to polish the teeth. So we are catering to the different modes, 2 minutes timer, and trying to make sure it is very easy, effective, and convenient as compared to manual toothbrushing.
All right. And, Dr. Anjana, we spoke about children and inculcating good habits in them. But, for our older viewers, what would you advise regarding dental health and oral hygiene?
Again, a very regular visit is very important, because in older individuals, at times you don't get the signs and symptoms which you will actually be able to get it when you're younger, because their canals are a little more calcified. So you can reach a fair amount of infection before they actually can detect it. So regular visits. And again, I would say that for older people, when it comes to oral hygiene, it is important to give them all these, new gadgets, because it is easier for them to, brush when it's an electronic brush. They don't have to work too hard. They can use water floss, and they can, instead of a regular floss, because it's much quicker and more easy, and maybe just a lot of regular checkups.
All right. So clearly very important to maintain our oral health and, have all these good practices if we're to maintain our beautiful smiles. Thank you so much, everyone, for joining us on the program today. Lots to think about, and thank you all for watching at home. Goodbye.